Okay, I think we're recording now.
Okay. This is Dr. Sally Wilson with Dr. Jane Woodrow of the Ohio Psychological Association, interviewing Dr. Cynthia White, former president of the Ohio Psychological Association. And this is for the oral history project. And we're hopefully going to archive this material. So thanks for interviewing. Our first question is a general one about your background, and that is, tell us what you want us to know about factors leading up to your choice of your profession. And perhaps, I believe you've always been an Ohioan, but maybe I'm wrong there.
Yeah, pretty much always an Ohioan, except for going away for training a few times. So I've always wanted to be a psychologist. I think I can remember in high school wanting to be a psychologist, and on my own studying introductory psychology books. And so I was a psychology major in college. I went to Allegheny College, got a bachelor's BA in psychology.
Well, how did you hear about the field of psychology? What made you even think of doing that?
That's very interesting. I'm not sure exactly how I heard of it.
Okay.
I just remember reading books about it in high school.
Okay.
Yeah. So,
Well, beyond your bachelor's degree in psychology, how did you choose the professional school? And I believe that you were part of the charter class of the Professional School of Psychology at Wright State University in Dayton.
well, so with my bachelor's degree, I got a job as a social worker at Hawthorne State Hospital, which was a long-term psychiatric institution, and spent then about 7 years trying to figure out if I wanted to go forward in psychology, or if I want to get an MBA, or if I wanted to be a lawyer. So I was exploring those things and ultimately decided I did want to pursue psychology, but I didn't really want to be a researcher. And so during that 7 years, I was getting my master's degree at the University of Akron in clinical psychology, and became a psychology assistant at Hawthorne State Hospital. And just about the time I got the master's degree, the School of Professional Psychology, I'd heard about that while I was working on the master's degree, that was coming. Very exciting. That was exactly what I wanted to do, because that was the practitioner-scientist model rather than the scientist-practitioner model, and that was exactly what I wanted to do. And so I had just gotten my master's degree when, as they were looking for a location for the school, and they settled on Dayton. They got the state legislature to approve of it and settled on Dayton for a location, and I applied to the school. That was a very interesting process. We had to go down to Dayton for an interview, for a group interview they had. And I remember they had a great display of fruit for all of us to eat, and nobody ate anything. I imagine the faculty had a great time after we all left. So I think everybody was so nervous. So I got accepted, and I think there were 30 of us in the first class, and it was exactly 15 men, 15 women. We had 10% African American. We had they tried to make it exactly representative of the population at large, is what they were trying to do, make a representative pool of people. And so being in the charter class was an adventure. It was exciting because everybody was very excited about it. I felt the support of the whole field of psychology, like everyone was for this and thought it was part of our coming of age that we could have something like this. And so it was exciting to be there. On the other hand, it was a new program. There were a lot of glitches. There were a lot of things that they didn't do after we got through the program. Oh, we were a special class. That was another thing. The charter class was special because we all had master's degrees. So it was an accelerated program. We only had to go to classes for 2 years and then do an internship. And then the people coming after us, I think there was one more class that was maybe partly accelerated, maybe one more accelerated class. And then then you had to start from the beginning, and there was no advantage to having had a master's degree. You just start at the beginning, and then I think it was a 3-year program. So we were coming from all different backgrounds and all different experiences, and they were trying to meld us into one approach.
There must have been a very general acceptance of the school. If I understand, you had a very nice internship, as did others in your program.
Well, that was part of when we first arrived, they were having trouble finding practicums for all of us. So that was one of the glitches, I think. But yeah, ultimately that happened. My internship, I got into an APA approved internship, but I had to take half pay. So it was split between the Nashville VA and Vanderbilt University.
Why was it half pay?
Well, that was all they had left over. And so they decided, if I would take, so that was $3,000 then that I got for my year there. And so they were willing to offer it to me as this new school. And I got some lovely references from the faculty, talking about that. Will you give our new program a try, kind of thing. Here's a good student from our new program. Will you give it a try? And so they agreed to give it a try, but only at half pay. So but it was so the internship was a great internship.
What changes have you seen in the school through the years as you've been in contact with it, or at least?
Well, I haven't. I have to say, I haven't
Okay.
really been.
I'm not really.
Yeah, I haven't kept
school.
up, unfortunately. Yeah. So I've really lost touch. I think most of the faculty that was there when I was there are no longer there. It was a great faculty too. Ron Fox was the dean and went on to become president of APA. A lot of I would say, movers and shakers in the field of psychology agreed to go start that school and put their heart into it. And
Do you happen to know about how many professional schools there are through the nation?
no,
I know of one in California.
yeah, one in Chicago.
So few, but they've been well accepted.
Yeah, I feel that. It feels like there's parity, PsyD, PhD, parity, and that people have forged a place for themselves.
Do you want to talk about your involvement in OPA and how your various roles evolved there?
Yeah, so starting out from that, so after I got into practice in Cleveland, I started right up. So one of the things, we had been basically indoctrinated into the idea that it was important to support the profession, that the profession wasn't going to run on its own, that we needed to be actively involved in it. And so I volunteered to be the recording secretary of the Cleveland Academy of Consulting Psychologists, and worked my way into president of that, and then as president of that, folded it up because it had run its course. Cleveland Psychological Association was growing, and we just decided we could integrate the two.
As I
programs.
recall, Cleveland Psychological Association included academics as well as practitioners, right?
Yes, but somehow the practice part of it was becoming more. So Cleveland Academy of Consulting Psychologists had been the practice group, and CPA maybe was more academic. Yes, it was less practice oriented for sure, but somehow it was becoming more practice oriented, and it didn't seem like there was any point in having two organizations. So we merged them together and merged some of their practices. So that was, I think, one of the things I did that year. We had a meeting to discuss it, decided this is what we should do, and then when I became active in Cleveland Psychological Association, my job was to be the delegate to OPA. So that's how I got started at OPA, was as the CPA delegate, and enjoyed very much coming down here for these meetings, and became more active. I was the chair of the Quality Assurance Committee.
And what did that do?
We were working on child custody evaluations, was the thing that I did. And also hospital privileges. Yeah. So.
Were you setting up guidelines
Yes.
for how to
Guidelines
do those?
for,
Yeah.
guidelines for hospital privileges and guidelines for child custody evaluations. So those were the two things I did, and then over the course of that, I can't remember how many years that was, 4 or 6. I mean, it was a while. And so that's when I threw my hat in the ring for OPA president. And so joined the executive committee in, I think, 1990, I believe. I think I was president in 91, 92. I'm not absolutely positive of that. And that was a transition time for OPA. I think we were growing, and we had been a mom and pop kind of shop, and decided that we needed to expand and become more professionally run in terms of having more policies and procedures. I think the whole society. I also served on my church board at the exact same time, and the church board was going through the same change of becoming less spontaneous and more policy driven. So I think that was the tenor of the time. The MBAs were taken over, and that was
well, and the organizations were getting larger, perhaps,
Yes.
too. And
yes,
you can be pretty informal when you're
when
very
you're
small.
Yeah.
But-
I believe
felt-
that our executive before the transition time, wasn't he the first paid executive
person, yeah.
for a state association? That was Henry Seaman.
Yeah.
Yeah.
Yep. So I came in as he was leaving. We had to spend our time restructuring and selecting a new executive director and figuring out how it was going to go forward into the future. And we selected a new interim. We made it an interim director, which was an idea that I had come in with from my church experience. We had gone through changing ministers at the same time, and there's a lot of churches apparently commonly do an interim as a transition, understanding transference kind of issues, or at least the difficulties of reattaching to a new minister so soon, and allowing a little time to decompress. And so that's what we did. We decided to go with an interim executive director.
Would you like to take a few minutes to digress and talk a little bit about your career? I believe that you have had a number of roles: private practice,
Oh, yeah, okay.
part-time in hospital, and then where
Okay,
you
sure. So let's see. So I did the internship at Vanderbilt, Nashville, VA. Then I did a postdoc at the Medical College of Ohio in neuropsychology and rehab. And then I came to Lorain Community Hospital to start a pain management program there. I was program director, and I started it. And then got recruited to go to St. Luke's Hospital and do their pain management program. And I was there until 1993 or 4, when St. Luke's closed or started to close, and they closed the pain program. And so at that point I went out into private practice, and worked a little bit at Marymount Hospital, another Cleveland hospital, and also just had two private offices, I guess. And then in 1997, I was offered consulting position with Cleveland Clinic at their new Westlake Family Health Center, and so I took that, and then was offered a staff position there in 1999, and fortunately decided to take that. I was reluctant after what had happened to St. Luke's, but I don't think Cleveland Clinic is in danger of folding. So that worked out well, and so that's what I've been doing since then, and working mostly with referrals from the primary care doctors for stress-related medical problems and depression and anxiety kind of issues.
Now, after your presidential year in OPA, you stayed doing some OPA stuff for a while, I think, and then took a hiatus.
Yeah, I took a long hiatus, yes. Right. Yes, what did I do after? Well, so of course you've got your year as past president.
Right.
So president-elect, president, past president, and then you were president, Jane, right?
Yeah. Yeah, I remember you telling me.
So you were president after Jane, after Sandy?
I can't remember what the sequence was. I don't remember.
I think
what
so.
It was.
Pretty closely, anyway.
I know Sandy talked me into running, but I remember you saying something about...
Oh, no, I think it was Dave Rogers, and then...
I think maybe it was Dave Rogers, yeah, and then me. And you said that as soon as you stop being president, the power just drains away.
Oh, yes.
It's an interesting experience.
Yes, it was. Everybody was calling me. Everybody was,
right.
needed me to decide this and that, and then, boom, it's all gone.
Do you want to talk a little bit about directions that you see in the future, either for professional schools or for our state association or state associations in general, or the profession? I'm leaving it kind of wide open here, your view of the future in various contexts.
Oh gosh, who knows really, but it certainly seems like the model that we've been working under is folding. And that was the other thing that I wanted to say about this, is that the other thing that was happening as I came in was managed care. We were just starting to struggle with what managed care was going to mean. That these restrictions on the practice, restrictions on the payment that we were getting on panels, not getting on panels, and all the hassles that have now been going on for 20 years. And now there's going to be more.
And they were doing a tremendous amount of managing.
Yes, it's been nice. That's true.
At the beginning, they would call you every 3 sessions or something, and you'd have to justify spending more time with your patient.
Right, so it did get better, didn't it?
Yeah, it got better.
And now it looks like it might be going to get worse. No, I don't know. I really feel optimistic about psychology in general. I feel like, especially like the functional MRIs that are showing the mind-body connection, that you can see concretely how the mind-body connection works, that I think it's validating what we do, and it's making it more understandable to the public. And so I think that there's going to be increasing demand for our services. But we have a lot of competition. The delivery model, the competition from cheaper providers, we'll say. The lesser trained and lesser paid providers can we prove that what we do is worth the extra training and the extra pay that we should be getting for our extra training? Can we prove that? I think we can, I think we can. We just have to, though. And that means we have to accept then, we have to do the quality, we have to do the outcome studies on our work. Mm-hmm. And I don't know how the solo practitioner is going to survive, the electronic record and all that. Mm-hmm. But I think in groups, we're going to be fine.
I did hear something on public radio just this last week talking about psychologists in particular, but other care providers, with the new model being trying to have everybody in one place, so it's one-stop shopping.
Right.
More team-oriented.
Right.
But one of the things that I heard as a change that I'm not sure I like was that the physician would, identifying a psychological need, call in.
Yeah. No, see, I'm excited about that.
For a half
right.
session.
No, I'm excited about exploring that model. I want to see, because the culture's gone, the culture is less reflective, doesn't want to spend lots of time exploring their psyche. They want to get on with it. And I'm just interested in exploring that model. Mm-hmm. I'm hoping I'm going to get a chance to do it. I think it can work. Mm-hmm. But I think it'll take a very high level of training to make it work. I mean, you have to know how to get in, like, what's the main issue here? What's going to be the most important place to make the change? Mm-hmm. And that takes experience and training. So if it's going to work, I think we're the ones that are going to be able to make it work. And I think I was listening to that same broadcast, and they were saying it's the younger ones. But I've been studying this, and I want to try it. I'm going to see if I can
you're
figure
in
out
a
how to
setting
try
where
it.
you
Well,
can.
I'm not, though. We went backwards. We were
Really?
in the family health center, physically located in the same building, but we kept ourselves isolated, and we were doing 45-minute sessions, and we were not allowing ourselves to be interrupted. The physicians would try, they tried for a while to get us to come out and see somebody urgently, and I'm with a patient. And so they've moved us out into our own building. They say cheaper rent was the rationale, but we're no longer co-located. But I think, in that system, I think there will be an opportunity to
move back in.
Yeah, I think there's going to be an opportunity to, at least on a pilot sort of basis, try something out.
Well, since you have had a strong interest in medical applications, another topic that comes up that might be of interest is prescription privileges for psychologists. What do you see there?
Yeah, I've never been for it myself. I just don't know how we can do both well. I think it's very complex. We're talking about the brain, and these drugs affect the body as well. And I don't know. It just seems
I think maybe though that we're more concerned about that than the physicians are.
You think they're more relaxed about it?
Well, I think they're just.
I know you do have the pharmacists who,
yeah,
but they,
oh, you're depressed. Here's a pill.
Right.
Right.
But I mean that comes from, like, they have an underpinning of training about whether the side effects, whether the patient has a condition that would be affected by the pill. I would hope that's what's going on.
I don't know that I see that.
And we do have the pharmacist as a backup if you Well, that would only be drug interactions. That wouldn't be drug disease interactions. So,
and it might be like the dentists who have very limited prescription privileges and watch out for possible interactions, or people with ill health where they might choose not to.
Yeah. I mean, we could. I think it's fine what we're doing now, which is that we can have both tracks, and the people that want to do it can do it. Yeah, I wouldn't stand in anybody's way.
It's just not something you want to do.
Well, it takes up a lot of time in the session, And if you've got a 20-minute session now, you can't be spending it on the drugs too. I mean, it's got to be.
What else comes to mind that you'd like to talk about here? You have a diplomate in.
No, I don't. Oh, what was that? Oh, that was a fake one.
Oh,
Is that still on there?
yes.
What does it say?
Diplomate, American Academy of Pain Management.
Oh, yeah. Well, that was because I was sort of, it's not fake, but I was grandfathered in. I didn't have to test for it or accomplish anything the way you do when you're getting the other diplomates.
Any questions beyond the ones we've asked that you wish you had been asked?
No, that was what I was thinking of covering.
Okay.
Great.
Well, thank you very much.
Well, you're
It
welcome.
was great talking with you again.
Yes.
Yep.
And your
It's
hiatus.
fun to think back. Oh, yes.
Your
we did
hiatus.
get into that.
You referred to.
was,
You want to
I was
wanna
going to
maybe
mention that. I
comment
was going to
about-
mention that. Yeah, so back in 1996, I adopted a baby and decided that, as a single mother, and decided that I couldn't keep all these irons in the fire, and so I just worked for my job, and I worked as a mother, and that was it until now. She's off in college. And so now
And
I've
you
come back.
may come back and do more.
Well, I'll do more. I'll come to things anyway.
Come to things, maybe be on committees or something
Maybe.
like that.
Were you active in Ohio Women in Psychology?
A little bit. A little bit. Came to something. Never held an office or did anything. Not so much. Not so much, really.
I've covered all the questions that came to my mind.
Me too. Okay, thank you.
Thank you so much.
Okay.
And did we say what date this was when we started out?
Perhaps not. You want
We
to?
might not have. This is October 30th, 2013.
Okay.
Okay.